Hi friends, I am working on this surgical guide case right now, and I wanted to show you something that's going to save you a little bit of a headache down the line if you kind of pay attention here. So these are analog surgical guides. This area right here is for approximation of implant placement, and this area right here is the bone reduction level to which I need the surgeon to reduce the bone to. So I usually will measure, I have a special guide that I use that I'll measure 15 millimeters from the incisal edge or from the occlusal all the way to here. And that's where we reduce the occlusion to. But look right here. When we started reducing occlusion quite a bit, not occlusion, I'm sorry. When we started reducing the height, the bone level quite a bit, we ended up with a fairly thick anterior flange right here. Now, also one more thing I wanted to mention, if you don't get enough height on your cases, what I pretty much do is just select the area where I need to raise it up. I can't talk this morning, sorry. Where I need to raise it up, and I'll actually raise it, and then this way I'll have the 15. Now it's probably going to be pushing a little bit on the patient and the soft tissue, but it's usually not a huge problem. Okay, so now we look at anterior flange, and we can see that this area right here is fairly thick. So what's going to happen if this is going to be a hybrid? And this is what the doctor is planning on doing, is doing a hybrid. Well, the bone's going to be right here, and the tissue is going to be right here. And we have all this area we're going to have to make up in order to produce proper lip support. Now you can see what's going to happen. You're going to end up, even if you round this off, you're going to end up with an anterior ledge. So for this particular case, I contact the doctor and I let him know, listen, I looked at the surgical guides for bone reduction and it looks like the anterior area is pretty thick. So if you want to do an implant supported restoration, I highly recommend doing something with a full coverage, with an overdenture type of thing. Um, and if that's the case, then that's something you need to talk to the patient before the surgery starts and not after everything has been done and you go to do a hybrid and then the patient goes, well, I don't like this. I don't like this ledge right here. It's a hygiene issue and everything else. So during the planning stage, this is a pretty good indication of where you're going to end up. So go ahead and look at your surgical guides and kind of be aware of what's going on and let your clinicians know what's going on as well. Okay. So hopefully this will help you guys, and I'll talk to you later. Bye.